Well, 2/3 of individuals have year-round allergies. So there are a number that have only seasonal allergies. But I think, vast majority of people deal with some degree of both year-round and some seasonal allergies. If you stratify those patients, it's estimated 25 to even as high as 30% or more of true allergic patients, or maybe others who are sensitized yet not yet showing clinical symptoms. But if you look at people having symptoms, about half of those individuals have moderate to severe allergies. So if you take the half that don't have moderate to severe and they have more mild allergies, those are the ones that oftentimes are controlled pretty well with over-the-counter antihistamines, and now that we see over-the-counter nasal sprays or steroid sprays, they can benefit from that. But for that other half, the moderate to severe allergic patient, and especially the group of those who also have concurrent asthma or maybe atopic dermatitis, those are the ones that benefit from specialty care, expert care, where they would see an allergist. It's very important in those patients to identify what they're allergic to. And then after that, I always call it a three-legged stool. You have one leg that's avoidance. If you identify what those patients are allergic to, you can very specifically develop targeted avoidance measures. That can be very helpful, and there are studies showing that avoidance measures can actually be as effective as drug management. And then you do have we have a lot of new, as I've already talked about previously, biologicals and new drugs and better delivery systems available for even our inhalers are now available, and some combination medications now approved for allergic rhinitis. And then the third, of course, is immunotherapy. For the very seasonal allergy, grass and ragweed allergy, we have the tablets available, but for most of our patients, they need the subcutaneous immunotherapy, which includes a lot of different allergens, including dust mite and other indoor allergens. Well, pollen allergies are difficult to avoid. Even inside, you have ingression of the pollen into the indoor environment, about 30% or so of the outdoor levels. But there are certain things they can do for pollen allergy. We tell people if they are outside and they're doing things that disturb the outdoor dust, they could wear a protective, highly rated, high efficiency respirator or face mask that can reduce your exposure. There's some pollens that tend to be higher levels at certain times of the day. The research hasn't really been done to see if that directly correlates to symptoms, but we generally tell people that mid-morning may be worse for some pollens, and if you're going to go outside to exercise, do it later in the day or very early in the morning. You do come in, be aware that you can carry a lot of the pollen into your home. Tracking mats can help. If you have a tracking mat either outside your door or right inside your door, it's nice to have it big enough, maybe 6 foot long, and that will remove pollen off the bottom of your shoes. Your clothing you've had on, especially been out for prolonged periods of time, go ahead and throw it in the washer and then take a shower. It's a real simple thing to wash the pollen both off yourself and especially out of your hair. The key is for allergists, we take care of the entire patient because the immune system involves the entire, we're not focused just on one organ, so we're able to help these patients. And I think the good thing about seeing an allergist, you can really provide relief for these patients, for they're miserable and they hate to be allergic, and those we really can impact their quality of life and provide them relief.